Hey folks, it's Dr. Walker from DentalWalker.com. Welcome back to the channel. Today, I'll talk a little about quercetin, Quercetin, a wonderful plant flavonoid. But before we get too far in this video, if you like what it is we're doing in terms of the content, go ahead and hit that like button for us so we'll know that you like the content. We'll do more videos like this going in the future. So, quercetin. Quercetin is one of those plant flavonoid which has great anti-inflammatory properties. But specifically, I'll talk about quercetin with respect in this video to how it works with zinc. Zinc is an extracellular ion for the most part when you take the zinc tablet. It needs to get into the cell where zinc does a wonderful job at eliminating or decreasing replication of several viruses. So it works well, but it needs to get into the cell. So to get it into the cell, you need something like quercetin, or EGCG, green tea extract, to help you get the zinc into the cell, where again zinc does a super job in terms of being lethal to several viral replication processes. Now, quercetin by itself, it doesn't get into your blood by itself really well, right? It needs to get help from several things, like bromelain or like vitamin C. Those two things help to get the quercetin from your gut into your blood. Once in your blood, it helps to get things like zinc into the cell. So it should be taken essentially without food, a little bit of water, ideally in the morning. And again, when you buy it, when you see it, it's going to be in combination with, again, quercetin in combination with bromelain or with vitamin C. Not by itself, typically. You'll get that. Now, you can get quercetin in several things, to include red grapes, red onions, or onions in general, red wine, chocolate, strawberries, teas in general. You can get quercetin in any of those things, but you need about 500 milligrams, is sort of what the experts will tell you, for it to do its normal job. Now, you can again get quercetin in red onions, but you'll need to get, in order to get 500 milligrams of quercetin, you need about 25 red onions. And I don't know about you, I love onions myself, but I do not love 25 onions in one day. So if you can get 25 onions in one day to get 500 milligrams of quercetin, great, go for it. Otherwise, look for quercetin that has vitamin C and bromelain in it. About 500 milligrams should work well for you. And again, it helps to get zinc into the cell. Once zinc is in the cell, it becomes a lethal thing for many viral replication process. A couple of cautions with quercetin, however: if you have low iron levels, or you have thyroid disorder, specifically hypothyroidism, can make it difficult to get your levels normalized. And again, if you have low iron, it can make your iron levels a little bit lower. So just be careful with that, and talk with your doctor again, obviously, before you try this supplement. And especially if you have low iron levels, just be careful of that. I would not take it if I have low iron levels. But again, that combination of things is super good. Quercetin has some anti-inflammatory properties in and of itself, which is great. But with respect to what we're trying to get done, and I've used it for about 4 years now, not an issue with it for the last 4 years. But those two things, it's one of those things that, again, one by itself doesn't work. The other one helps to get it to where it needs to go. And you'll see some articles written about quercetin saying it's not that great of a drug and so forth, or that you see some articles written about the fact that zinc is not very good in terms of viral replication, lethality, and so forth. You'll see some articles that talks about that it's not very good by itself. But what they do, and it's I think it's intended to be done this way, for some person to say zinc is not that great of an ion. But what they do is they put zinc in situations where it's not normally suggested to take zinc, right? So ideally, zinc and quercetin works well together. But what they'll do is they'll test zinc in a situation where it doesn't have any quercetin to help it transport zinc into the cell, and then they'll say, oh, it did not do a great job in terms of reducing someone's duration of viral illness. Again, it's like saying a car doesn't work when a car has no gas. You need gas in the car for it to work. You need quercetin to transport zinc into the cell for zinc to do its job really, really well. So get those two things together. Again, double check with your doctor. Be certain that it's something you can take yourself. And again, just to be certain that you don't have a thyroid disorder or you have an iron level disorder that could cause you some problem. But if any of those two things, either of those two things is a non-issue for you, confirm with them that's something you're going to do. And again, it's worked well for me the last 4 years. Hope it does the same thing for you as well. Thanks for listening, Dr. Walker.